بسم الله الرحمن الرحيم. Ventilator waveform analysis. Ventilator press cycle and pressure control ventilation, or we can say in another way, the press delivery by the ventilator to the patient during inspiration and pressure control ventilation. And this can be analyzed by studying the pressure time curve and at the same time to see the response of inspirator and expirator demand valve when they open and when they close. This is the ventilator press delivery and pressure controlled ventilation, and this is the pressure time curve. This pressure time curve is formed of triggering, rising time. This is the preset pressure, and this is the preset inspirator time, and this is the beep level. When you start here by triggering, this triggering may be by flow or pressure in assisted control to develop this deflection, or by time if it is controlled mandatory ventilations, and this deflection will not be present, and this time will be determined by the preset respiratory rate. After triggering, the demand valve will open, allow the press delivery, and the flow will start. How fast the flow? This is determined by the rising time. If it is short, the flow will be fast. And this flow will develop this pressure. And this is the preset pressure. When it is reached, it is maintained all through the cycle till the end of the inspiratory time. By the end of inspiratory time, the demand valve will close to end this inspiration. And at the same time, the exhalation valve will open for the release of this delivered tidal volume. And the pressure will drop till it reaches the beep where it closes. This is a pressure time curve. Look at the inspirator time is large. And here the flow came to zero before the end of the inspiratory time to develop an inspiratory pause. When we come to this to analyze it, by the start of the flow, this flow will go through the bronchial tree to develop pressure resistance. And at the same time, the flow will increase the alveolar tidal volume. So the pressure, this pressure, peak inspiratory pressure, equals the two pressure resistance, the blue one, and pressure elastance. Starts with the high pressure resistance and with gradual increase in the pressure elastance by inflation of the alveoli. When the pressure elastance, alveolar pressure, equals the airway pressure, at this point no flow. So the flow is decelerating because of this is the peak one, and the concomitant increase in the alveolar pressure will be associated with concomitant decrease in the flow till the flow is zero. Flow is zero, but the demand valve is still open. We know that the demand valve will close by the order at the end of inspiratory time. So during this inspiratory pause, the demand valve is open and the patient can take his breath without triggering. At the end of inspiratory time, the demand valve will close and the exhalation valve will open for the release of this tidal volume. So this is the flow. And the function of this exhalation valve is to keep the beep constant. So the flow continues so long as the beep is constant at the preset value. When the flow ends, the demand valve will close and does not allow the beep to drop. Again, this is the same like previous discussion. The inspiratory time is large, so this an inspiratory pause. This is an inspiratory pause. The demand valve is open and closes at the end of the inspiratory preset inspiratory time. And when it closes, the exhalation valve will open for exhalation. So elongation or prolonged inspiratory time may be associated with the development of an inspiratory pause. And during this pause, the patient can take another breath. In this case, the inspiratory time is shorter than the previous one. This one we look at the flow does not come to zero, and the demand valve closes early according to the preset inspiratory time. That's why there is no inspiratory pause. And the tidal volume for sure will be smaller than the previous one. Thank you.